Hello, everyone. Welcome to today's seminar on Grand Rounds, Radon and Uranium in Groundwater. Thank you all for being with us here today. Just going to give a few seconds here for any latecomers. All right, we'll go ahead and get started. Welcome and thank you for joining us for our seminar, Grand Rounds. My name is Nicole Dutra. I'm a senior project coordinator here at the National Environmental Health Association, NEHA for short, and I will be your host today. Let me quickly go over the agenda with you. To begin today's seminar, I will provide a brief overview of who the National Environmental Health Association is and what we do. I'll provide some details about our 2024 annual educational conference that's later this year. Then we have a short poll for the audience. And then after that, we will jump into our presentation. I will introduce our speaker today, who has an amazing presentation planned for you. We will also follow his presentation with a short Q&A session to allow you to ask him some questions. I will then introduce to you our guest panelists, who are all experts in the field, and we will kick off a discussion and open up Q&A for questions from the audience. With that, allow me to cover a few housekeeping items before we get started. Please note that the webinar is being recorded. The webinar recording will be uploaded onto the NEHA website for Grand Rounds. You will be able to find the recordings for all of our previous seminars there as well. The web address is neha.org/EH-grand-rounds, and we'll drop that into the chat for you. If you have any questions for our speaker during the presentation, please use the Q&A box to submit your questions, and we will attend to them after the presentation. In addition, if you have any questions for our panelists later during the panel discussion, also use the Q&A to submit your questions. At the conclusion of the webinar, you will receive a link to take part in an evaluation survey to provide us any feedback and comments on today's webinar. Now, for those of you who may not be familiar with NEHA, allow me to provide a short overview of who we are. As an association, everything we do is to build, sustain, and empower environmental public health professionals so that they're equipped and prepared to protect the health of communities across the country. We support environmental public health by continuously providing the most up-to-date trainings, tools, and resources to the workforce who specialize in so many different fields considered environmental public health. NEHA is focused on increasing the knowledge and skills across all of our fields to build upon our workforce capacity, efficiency, and effectiveness. We also offer credentials to certify the expertise of our workforce. In addition to our large online library of trainings, seminars, and available tools and resources, we host an annual educational conference, which includes multiple sessions focused on many different fields of environmental public health, like policy and regulation, extreme weather preparedness and response, food safety, private wells, water quality, climate change, wildfire response, and there's so many more. No matter where you are in your educational journey or your professional career, NEHA has something for you. Check out our website at neha.org and find out more information. As I mentioned, each year NEHA hosts our annual educational conference. This year's will be in Pittsburgh, Pennsylvania on July 15th through the 18th. Registration is currently open, and I highly encourage you to attend. You can learn more and register at neha.org/AEC, or go ahead and scan the QR code that's on your screen. Now it is time for a poll of the audience. We have 3 questions we would like to ask everyone. We'll pull those up for you. Give us just a second. All right, so here we have question number 1. Does your drinking water come from a private water source, like a well or a spring? Go ahead and submit your answers. Hey, they're coming in. Thank you. Thank you. It's looking like the majority no, but that's a good percentage of yes. All right, and then our second question that we had there for you. So well water contaminants are substances that can affect the quality and safety of well water. Tell us which of the following common well contaminants are you knowledgeable of? Select all of them that apply to you. And the last question we have there for you is, how would you rate your level of knowledge on radon or uranium in groundwater? Great. All right, looks like many of you have a good overview of a lot of the different contaminants. All right, thank you for participating in the poll today. We'll go ahead and get started. All right. So please welcome our speaker today, Evan Kane, who manages the private well program for Wake County in North Carolina. In this role, he leads a team of 6 environmental health professionals in permitting and inspecting new private drinking water wells, as well as providing education, testing, technical assistance, and financial assistance for private well users. Prior to joining Wake County government in 2015, he worked for the North Carolina Department of Environmental Quality for 14 years, implementing and developing programs for groundwater protection and groundwater monitoring. He is a North Carolina licensed geologist and has a bachelor's and master's degree in geology from North Carolina State University. Evan, welcome. And I will go ahead and pass the floor over to you.
All right. Thank you, Nicole, for that introduction.
Mm-hmm.
You hear me okay? All right, great.
Yeah.
We'll jump right in since we don't have a whole lot of time to an issue that has been a very important, high priority issue for the private well program in Wake County, North Carolina. But I hope that folks on this call and will get the impression and takeaway that this is an issue that has national relevance anywhere that private wells are in use, whether it may be specific to uranium and radon or other contaminants that may get overlooked sometimes with private wells. Just a little bit of, we'll cover a little bit of background and technical information. Then we'll talk about what Wake County has done to respond to this issue. And finally close with maybe some thoughts about what the opportunities are within this topic that folks might explore in other areas, where I would hope that new leaders can advance the practice of environmental and public health. So Wake County, North Carolina is located in the Piedmont of the eastern part of the United States. We are home to the capital, Raleigh, North Carolina, which is actually a separate city from Durham. If you've traveled around, you might hear of Raleigh, Durham. There's a little bit of pride of place there. We have a population of just over 1 million people, and we are one of the corners of the research triangle. And so sometimes it is a bit of a surprise to people to learn that Wake County has about 90,000 residents who depend on private drinking water wells. These are wells that serve one house, maybe two, maybe three houses, but they're typically not operated by a professional or anyone who has a professional education in drinking water systems. And these are not just wells that serve old farmhouses and things like that. We actually have about 300 new private drinking water wells installed each year in Wake County, serving new construction, new subdivisions, and so forth. And we receive requests from about 260 homeowners a year for us to come out and collect samples from their wells on a voluntary basis, where they're curious about their water quality, they have some concerns, they've seen something change, and they'd like the county to come out and take a look at that. And a really important paradigm with private wells in North Carolina and really throughout the country in many places is that the homeowner is effectively a water system operator, whether they realize that or not. And for better or for worse, that puts them in control of their drinking water system, but it also leaves them in the position of having to know what tests are necessary, how frequently should they test, and what do those test results mean, and how are they going to deal with them. Within Wake County, we have been tracking water quality from the testing that we do for about 20 years now in a database. And looking at that data several years ago, we found that though we test for a lot of different man-made chemicals, including things like TCE, a trichloroethylene dry cleaning solvent, dieldrin, which is a termiticide that was applied heavily to house foundations in the middle of the 20th century, nitrates and things like that. The most common contaminant that we had found above drinking water standards in wells in Wake County was actually uranium, as you can see here on this graph. That second bar labeled gross alpha is essentially a proxy for uranium. It's a measure of radioactivity from a couple of different minerals. But uranium in Wake County is the primary driver of those gross alpha exceedances. And so I focus on this slide a little bit because man-made contaminants get a lot of attention. But in Wake County, what we found was these naturally occurring contaminants were actually far more common. Mapping those test results several years ago, we were not too surprised to see that they were associated with a large body of young granitic rock. I say young in geologic terms, in the eastern half of the county, which has altered some of the surrounding rock formations and essentially placed higher levels of uranium in the rock underground, which can then leach into groundwater. So I say this is a little bit of a surprising result that we had such higher rates of contamination with uranium and gross alpha, these naturally occurring contaminants. But in fact, nationally, this is not really surprising. Nationally, there was a USGS study several years ago testing a couple thousand domestic wells around the country for a wide variety of things, man-made contaminants, inorganics, heavy metals, and so forth. And that study, published, I think, in 2014, actually found that the most common contaminants to exceed health-based benchmarks were naturally occurring arsenic and radon, and in third place, nitrate, which is human-caused contamination. But the most common contaminants they found were typically coming from the underlying bedrock. So first point of relevance nationally is that, you know, your county may be different, your geology may be different, but the county you work in may have more often a problem with naturally occurring contaminants than man-made contaminants, depending on the geology. The other thing we had to recognize quickly after looking at this data set was that uranium is really just the start of a long chain of radioactive decay that generates multiple elements of different half-lives that stick around longer or shorter. And so this chart here shows the complete uranium-238 decay chain all the way down to stable lead-206. And that's maybe a lot to take in, but from a public health standpoint, there's really three primary decay products or elements that we're concerned with. And those are uranium, radium, and radon. And it's important to note here that radon, unlike uranium and radium, is a gas. Uranium and radium are mineral elements, and so they're going to stay in water, but radon being a gas is going to tend to come out of the water. This is important because it affects the routes of exposure for these contaminants and then how you have to respond to them. Obviously, drinking water is what we think of with private drinking water wells. And so that is a primary route of exposure for uranium and radium especially. We also have to keep in mind that people use water from wells for cooking. So you make a pot of rice, the rice absorbs that water, whatever contaminants are in that water can enter the body while eating that cooked food. Lastly, though, with radon, as I mentioned, because it's a gas, we have a couple of different routes of exposure. A lot of people have heard about radon entering the house through the foundation. And this is a concern in many places. Radon, when you have high levels of radon in well water, that adds a new route of exposure, a route of entry into the house. And with that route of entry, we're talking primarily about a route of exposure through inhalation. Obviously, radon is in the water, and so when you drink the water, you can also ingest the radon. But any place that water is used in the home, that radon is going to tend to off-gas into the air and immediately begin generating its daughter products from the radioactive decay. We also have to think about the health risks of these different elements. Uranium, the primary risk is actually not from its radioactive behavior, but its behavior as a heavy metal. And so the primary concern, the drinking water standard has been set based on kidney toxicity resulting from uranium being a heavy metal. There is also some increased risk of cancer due to the radioactivity of uranium, but the primary driver of that drinking water standard is its kidney toxicity. And we're talking about, in the case of uranium, kidney toxicity that can develop within a few weeks or months of exposure. Unlike many other things where we talk about lifetime of exposure, increasing risk of cancer, if you have very high levels of uranium, it can produce health effects in the short term. Radium, many people are familiar with as a driver of increased risk of bone cancer because radium is chemically very similar to calcium, and so the bones can take up radium in place of calcium. And lastly, with radon, we're talking about increased risk of different cancers, primarily increased risk of lung cancer from inhalation. There's also some evidence that points to an increased risk of stomach cancer from ingestion of water containing high levels of radon. Uranium and radium both have distinct drinking water standards under the Federal Safe Drinking Water Act. Radon, unfortunately, is not regulated under the Safe Drinking Water Act. And so if you move around the country, look at different states' recommendations with regard to radon in water, you'll see different thresholds based on various studies. In North Carolina, we kind of have a sliding scale where we consider 10,000 picocuries per liter and up to be high levels of radon. 4,000 to 10,000 is, say, we would say moderate, and below 4,000 we would consider low. Different states may set that threshold a little more, a little lower. And unfortunately, in the absence of a drinking water standard, this becomes a key point for advising well users about their options and their choices for dealing with levels of radon in their water. So one of the first things people want to know after we talk about these contaminants and the potential that they are in well water is, how do you fix it? And the situation with any of these radionuclides is really very site specific. It's going to depend on the specific mix of radionuclides. Not every well gets every contaminant. We see some wells with only high levels of uranium. We see some wells that have high levels of uranium and radon. And then we see others that have high levels of radon, but not high levels of uranium or other radionuclides. It's also going to depend on other mineral content, which we could call confounders, things like hardness and iron, and whether you have high levels of other minerals that need to be taken out in order to make the treatment for the health effects effective. It's also going to depend on the levels of radon in the air overall, whether you have public water available to you and what the cost might be for connecting to public water versus fixing the problem with your well water. It's going to depend on the resident and the homeowner's financial situation, whether they have the reserves to actually install treatment systems or connect to that public water system. And it's going to depend on the resident and homeowner's risk tolerance. Because, as I mentioned, the homeowner is the water system operator. They get to make choices about how they want to deal with issues with their well water. And then the cost, we're talking about maybe anywhere from $1,500 for a professionally installed reverse osmosis treatment unit within the kitchen that would just treat water at the kitchen sink and the ice maker, water dispenser, and the refrigerator. And that would be effective against uranium and radium, provided you don't have very high levels or other confounders that have to be removed first. But the cost can also go as high as $15,000, especially if you have high levels of radon. Radon, since we're talking about it creating an inhalation hazard, you have to remove radon from all of the water entering the house, which means a larger treatment system. And then that treatment system for radon specifically is very sensitive to mineral contaminants. So it's going to need pre-treatment. Then it needs a pump to repressurize the water and send it out throughout the house. These radon treatment units typically work by essentially blowing bubbles through a chamber of water and then venting the gas with radon outside the house above the roof line. So that's a bit of the technical background. We'll shift now into what Wake County, North Carolina has done in response to understanding this issue. Our first step was simply to establish testing recommendations for those people who come requesting voluntary testing of their well water. Based on the data that we had, we first published a testing recommendation for the eastern half of the county in 2016. And knowing that uranium is just the start of this decay chain, that we're really talking about a suite of contaminants, we put together what we call the RADS package, which includes testing for uranium, for gross alpha activity, and for radon in water. And we come out and collect those samples, send them to a laboratory, and interpret the results for the resident. But we also deliver, when we do this testing, we deliver a low-cost test pack for testing radon in the indoor air. That's really important to choosing the right mitigation approach for well water, because we want to know how much is the well water contributing to the overall radon levels in the indoor air, and then help the resident make decisions about how to deal with that. We also instituted a couple of years later, after changing our local regulations, a testing requirement. Any new well or any new construction that's going to be served by a private well has to be tested for a suite of things under our local regulations, including bacteria, heavy metals, nitrate, and so forth. That had been longstanding. What we added in 2019 was a requirement to test for gross alpha activity. And we require with any of these tests within Wake County, we actually limit the issuance of a certificate of occupancy for a new home until we have clean test results from the well or from a mitigation system installed to deal with contamination. So we have these protections in place, the testing recommendations and requirements on new wells, but we recognize that with 40,000 wells already in service in the county, a large number of people were not going to get this message. We're not going to get the testing that's required for new homes. So in 2019, in addition to putting this rule in place, we also launched a massive public awareness campaign. This consisted of a press event where media was invited to see a presentation and ask questions. 19,000 direct mailers were sent to addresses where we suspected a private well was in use serving residents. We held a series of community meetings at the beginning of this awareness campaign and partway through after people had gotten well testing to help them understand those results. We also had an opportunity to deliver a presentation at Grand Rounds for medical doctors at one of the major hospitals here and help them understand that many of their patients may be drinking water from a source that has not been tested for these things, and they may be suffering health effects from this. We had training events for home professionals like home inspectors, plumbers, water treatment installers, so that they would understand when they come out to look at a well, do a home inspection, install a treatment system, they understand that these things are out there and need to be dealt with. And we also provided financial assistance with testing for people who are of limited income and provided a fairly streamlined approach to getting approval for that financial assistance, so people didn't have to provide a lot of paperwork just to prove to us that they were too poor to pay for testing. Outcomes from that campaign, we had about 350,000 people click on the webpage that we created for this campaign in the first couple of months. We dealt with about 1,300 phone calls in just the span of 3 weeks. We had about 100 households request financial assistance with well testing, and over 600 people attended our community meetings. And in the end, we got about 1,200 additional wells tested. So out of 19,000 notices sent, 1,200 additional wells is somewhere around 7 or 8%. It seems pretty low, but based on past awareness campaigns we've done, we felt like that was a pretty good response rate. And it also represents nearly 4 years of our regular voluntary testing output. This is an area that we continue to focus on, continue to make a priority of our program, and continue to reach out to homeowners, to realtors and others to make sure that they're aware of it. And it's built a lot of collaboration, continues to be a focus. There are areas for improvement. There's areas where we still face challenges, but I'll also zoom back out away from Wake County and think about this nationally, especially for people who are new to the environmental health profession and entering it and looking for where are the places that advancements could be made. And I'll just point out a few places. Number one for me is the medical community understanding. From working with the healthcare community, we realized that many doctors and other primary care providers are simply not aware and not asking about their patients' source of water at home. And then if they do ask about it, they're really not aware what the major risks are and threats are to that water supply. Second area for improvement is the real estate community and home improvement professionals. We've really made a good inroads in with the real estate community, who in North Carolina, realtors have to get continuing education. We have a canned package of training on private wells and septic systems that we deliver for lunch and learns and other things like that to individual real estate offices. Home inspectors are another area where we need to make more inroads, because our understanding is that most home inspectors really are not looking for things beyond what a lender might require, which is going to tend to be coliform bacteria, lead, and nitrate. Also, I think there's a great opportunity, great challenge in approaching private well problems from a comprehensive perspective, a whole well approach, as I call it. When we work with other agencies like our State Department of Environmental Quality, and they're looking into contamination resulting from human activities, they're really only looking for those target contaminants associated with that gas station or a solvent spill or something like that. And they're not checking for things like naturally occurring contaminants. This is understandable. They have a job to do that is enforcement driven. But we're really trying to push, certainly within the areas that we can control within Wake County government, a whole well approach where we look for everything, those man-made contaminants, but also these naturally occurring ones, and the ones that the lenders are going to want testing for, which are also of key importance for health. And lastly, a lesson that we have learned from this is that all of these well water issues have a very key intersection with the topic of affordable housing. When you hear someone say, well, I've been drinking this water my whole life and I'm fine, what's really underpinning that is some thought of what is it going to cost to care about more things in my well water and focus my attention on them and fix those problems if I find them. And I want to stay in my house, and I want my housing costs to not go up. And so focusing on a new problem that you hadn't heard about before in your well water becomes an issue of affordable housing. And we don't want the testing and increased awareness that we do to create issues with people being able to afford to stay in their homes and have a healthy home. So those are some areas where folks getting into the field today might look for opportunities to make advancements for the overall environmental health profession. I hope this has been helpful to you, and I will end the presentation there, and I think transition into Q&A. Thanks, Nicole.
Great. Thank you so much, Evan. That was a great presentation. We do have some questions in the Q&A. I will proceed with doing a couple right now. Then Evan, if you wouldn't mind answering in the Q&A the remaining. Goya had a question. Are there any government programs that subsidize testing costs for low-income households?
That's a great question. There are a few things. Within Wake County, we have, through our Board of Commissioners, instituted a fee structure that allows us to offer discounted testing to people based on income levels. I think if there are other financial assistance options for the testing component, it's going to typically be at the local government level. There may be other states, and I'd be happy to learn about them, that offer something similar to what we do at the county.
Okay. And then Michael asked, what is the cost to a resident to have the testing packages done?
Another good question. If you go through a private laboratory and get a fairly comprehensive set of tests, you're talking about $300 to $500, maybe more. Within Wake County, we subsidize the cost even for people who pay the full fee to the county. We subsidize the cost a little bit, so it winds up being closer to $200 to $300, depending on the tests you request.
Okay, great. All right, so to the audience, if you have additional questions for Evan, please drop them into the Q&A, and he'll be addressing those in the box for you. We're going to go ahead and continue on. Joining our panel today, we have Rachel McCauley, who is a hydrologist in the private well program for Wake County in North Carolina. She's a registered environmental health specialist and North Carolina licensed geologist with a master's degree in geology from North Carolina State University. In the private well program, Rachel evaluates known contamination sources, local geology, and land use history to determine permitting requirements for new drinking water wells. She provides technical assistance and education to private well users and engages in public outreach for professionals, homeowners, and students. Next, we have Philip Ray Gibson, who works to empower others, particularly people of historically marginalized communities, with information about how to test for and reduce their exposure to radon. Philip has served as the North Carolina Radon Program Manager. In this role, he has forged significant research and administrative partnerships to lower the incidence of radon-induced lung cancer. Philip is the recipient of awards from Duke Cancer Institute, the North Carolina Society of Public Health Education, and the Dusty Joy Foundation for his efforts to reduce radon-induced lung cancer. And lastly, allow me to introduce Tom DeBell. Tom is an environmental health engineer in the private drinking water program for the state of Vermont. With a passion for safeguarding water quality, Tom has spearheaded projects focused on mitigating and remediating the impacts of flooding on private water systems, orchestrating testing campaigns to better understand groundwater contamination, and works to extend public health messaging to private water users across the state of Vermont. In his role, Tom has provided educational and technical assistance to thousands of Vermonters experiencing water quality issues through the state's drinking water hotline. Tom regularly works collaboratively with multidisciplinary teams across state and federal agencies with the goal to enhance awareness of groundwater contaminants and actively works towards reducing the public's exposure to harmful contaminants. He holds a master's degree in biological engineering with a water resources emphasis from North Carolina State University and an undergraduate degree in ecological engineering with a minor in chemistry from Oregon State. So thank you for the three of you being here with us today. Allow me to remind the audience, please use the Q&A box to drop any questions that you may want to ask of our experts today. And I will kick off the discussion by asking all three of you, what are the most common and significant challenges that you've faced with groundwater or private water?
I guess I'll go ahead and start. Hey, everyone. Hope you're having a great Thursday. As Nicole mentioned when she did our introductions, I work in the groundwater and private wells team with Evan, who just gave that awesome presentation. One of the most significant challenges that we see, or that I see, is really that educational component, because of the fact that people who are on private wells are their own water system operator. So many times they just have no idea what they should be testing for or when they should be testing for it. So really trying to help people understand that this is something that's really important and that it's kind of the onus is on them to do it. And then, getting them to look at it from that whole well approach that Evan mentioned as well, to think about the fact that just because you test for one thing doesn't mean that your water is completely safe. You need to think about it from like a holistic approach.
Great. Thank you, Rachel.
Yeah, and I'd definitely echo that point. I think the awareness of the risks, I think so often people feel more inclined to test their water if they notice like it tastes funny or if it looks brown. And really, I think changing the perception that, looks can be deceiving, that things like uranium and radon are odorless, tasteless. So those risks could be there, even if, there's not some sort of physical reminder that something could be wrong with the water supply. And then I think oftentimes too, there's a perception that, testing for bacteria, a lot of people have done traditionally, but that there is, like the whole well approach, that there is kind of a suite of things that we know are naturally occurring and fairly common that should also be tested for. So a lot of, I think, the educational piece, and then maybe changing some kind of preconceived notions.
I think, Tom.
So I'll echo what it is that my colleagues are speaking about, and say that it is education, but I'm going to narrow in and recognize something that we've discovered at the state level with regard to radon or radionuclides. And that is, number one, it's a very complicated subject for a lot of people. So it's very technical, and trying to get people to understand this potential risk, which is a risk in the future rather than an immediate reaction, unlike uranium, as Evan mentioned. But what we've found is that it is people of color, and particularly those who are Spanish speakers, who are less likely to know about these issues, and probably don't seek out information, nor do they really want the information, because it may cause them to be upset or excitable or something around an issue that they may not have money to then resolve. So you saw the cost, of course, that Evan shared. So I would echo that it is education, but then within the state level, we're recognizing that exposure to radon or radionuclides is a health disparity issue.
And I would have to agree with that. In fact, what is there any targeted focus to assist communities that face challenges due to socioeconomic or other disadvantages?
So I'll start and say that yes. What I recognize is that this shell that I'm in, this white, older male shell, is not the vehicle for communicating to all populations. And so I need partnerships and educators who look differently, speak differently than I do, speak another language. And so my efforts have been building partnerships with different organizations and people to try to get the word out. So for example, I'm engaging with a minister of an African-American church in Durham, for example, who has a community of about 4,000 congregants. So working with him, to working with NIEHS, the National Institutes of Environmental Health Sciences, who has a women's health awareness program, which is reaching mainly Black and Brown women within the Durham area. Statewide, I'm working with Latin 19, which is a subcommittee of DHHS, the Department of Health and Human Services, that I work for. And there's many others that I need to empower with information, with free test kits, things like that, to raise awareness.
Oh, that sounds great. Thank you, Philip, for sharing that. So, Rachel, I'm going to come back to you for the challenges that you have mentioned. What practices or strategies have you implemented to try to mitigate those?
Yeah, so, we talked about this whole education component, really trying to just provide that as a service to the county. So any opportunity we get to spread awareness, whether it's educating homeowners as they call in, or talking to the builders and the contractors and the well drillers that we talk to or that we interact with every day, or, real estate professionals, really just kind of trying to hone in on that education. We also are doing this really cool thing. We're working with this organization called the Water Now Alliance right now, and they've got a project accelerator program where basically they are working with us to develop skills for the most effective types of outreach for underserved communities and those people who may need help, but maybe a little bit harder to reach. And I think the goal there is really, like there's this lack of trust in the community toward government entities, especially, and often rightly so. And so I think one of the things that we are continuously working on is trying to figure out how to reach those communities without making them feel targeted or causing more harm. So partnering with people who are more qualified to do these things is really important.
Great, thank you, Rachel. I'm going to address a couple of questions that are in the chat, actually, for you. From Vinod, he says, I am a graduate student in environmental health due to graduate in spring 2024. Is it possible for a student like me to get certified in water quality testing? If one of you would answer that.
So just to make it clear, that the North Carolina Radon program is actually focused on radon in air. However, I work very closely with the Occupational and Environmental Epidemiologist epidemiology office, who has radionuclides in water as an issue that they're concerned about. So in terms of certification, I would say that in North Carolina, I don't believe there are already laws, rules, or regulations about getting testing, if you will, as a process. It would be really a recommendation that I and probably others would make, which is to hire a certified professional. But then it's a matter of finding the certified professional, which I know there are some lists out there.
Great. Tom, I'm going to throw this question your way. With all the new construction across our great state, is there any push for passive subslab depressurization?
Yeah, so the radon in air is a little bit outside my expertise. I know in Vermont, we have had a lot of campaigns for air testing. So that's something we know about. 1 in 7 homes in Vermont do have elevated radon. So that would be a question a little outside my purview, but I know there are a lot of new mitigation and construction standards being looked at to make it easier to mitigate if there are radon concerns in a particular area.
So I can answer that question if they're referring to North Carolina, and I'm assuming that they are. So there is no push really for anything regarding radon as a legislative matter. I know that most recently there was legislation requiring schools in North Carolina to actually begin testing for radon. So that is in its infancy and is oddly enough, outside of our office. It's in the hands of the Department of Public Instruction. There are a number of builders, though, in North Carolina that are voluntarily installing passive radon mitigation systems. So, national builders like D.R. Horton, or private builders in Western North Carolina like JAG or Jade and others are in fact using passive systems. And we're monitoring that through a number of vehicles like Real Estate MLS. We have a 4-hour continuing education course for real estate brokers on radon. And that's another place where I get this information.
Great. Rachel, I'm going to ask a question from Michael. What does your typical inspection of a water well look like?
Well, that's a good question. So when a well first gets drilled, there are a couple of different inspections that have to happen. When they initially stick the hole in the ground, there's an inspector will come out to witness the grouting of that well. So it's supposed to be grouted to like a specific depth using a specific material. And they'll also kind of use that inspection time to verify the location that it was put in the right place. And then the next step is for the wellhead to be installed. And when we come out to take a look at that, we're making sure that all of the construction standards are up to code. So it has to be 12 inches above the ground surface. There has to be a specific type of faucet or spigot on the well, and there has to be certain types of tags with information on them. So we're looking at all of that, and then collecting the samples. That's like a big part of the inspection, especially for new wells, is collecting specific water quality samples that are determined before the well permit is issued. I hope that answers the question.
Thank you. So this question was from Mindy. And I will throw this, Philip, probably around radon and uranium, or Rachel. How often are radon and uranium found together? Are wells positive for radon at the same level as uranium?
Okay, so let me think about how to answer. So uranium is an element that's radioactive. It's in the ground, it's in the rock, and then it decays over time. And radon is one of its daughter products. So radon kind of increases as uranium decreases, kind of. So it really kind of depends. Sometimes we see them together. Sometimes we see elevated of one and not the other. There are so many other factors that are going into it, other types of, other elements or minerals in the rock, conditions of the water, how long it's been in contact with the rock underground. So complicated conditions, I guess.
Yeah, and I can speak a little bit to Vermont. We do have pretty good data. We do see some correlation, but like Rachel said, it's not one-to-one. So we don't always see, like, if you have really high uranium that you're automatically going to have radon. In cases where we see that, it is usually a good idea to check and make sure there's not elevated radon in the home or in the water. But it's not like a direct comparison. We haven't seen really strong evidence that there's kind of a causation effect there, but certainly something we want to look at.
Thank you. And let's see here. Will asked, is it safe to shower or wash dishes using water with high uranium or radon? Philip?
Sure. First off, just to say my preference is to never use the word safe because it's all about risk. And it's, as Evan mentioned, it's what your tolerance for risk is. So with that in mind, when it comes to uranium, that's going to be in well water, and it's not something that is emitted into the air, into the home. So in terms of drinking well water that has uranium and or radon, or even gross alpha or gross beta particles, is really a complicated answer because radon doesn't have a public health standard, and so we don't know if you consume X, right, this amount, that you're going to definitely have this response in your body at this particular time. We have a risk table that we can point to, but that isn't an absolute. So I know that that's not a straightforward answer because we don't know, right? We know that radiation causes these impacts, negative impacts to cells, whether it be stomach or lung, as an example. But your individual genetic makeup also plays a role in your susceptibility to cancer.
Thank you, Philip.
I can add a little bit to that if that's okay.
Okay, quick. I do have one more question for you, Rachel, as well.
Okay, great. Yeah, I was just going to say it's important to think about exposure pathways too. So inhalation versus drinking water, which can impact, your showering, for instance. You're not going to get exposure from drinking, but you're going to get exposure from inhalation.
Very true. Great. So we have a follow-up question for you, Rachel, from Michael. Is there a requirement for water well drillers to be certified to complete that work at a state or local level in North Carolina? If you're checking grout and annular space, etc., I imagine a PG has to be on site while drilling occurs.
Yeah, so the first part of that, yes, you definitely have to be state certified to drill a well anywhere in North Carolina. In Wake County, we actually have a couple of extra requirements too. They have to be registered with the county and then bonded and insured for, I'm not sure exactly what the amount is for, but yeah, there are very specific requirements that have to be met in order for you to be able to do work as a well contractor. And then the second part of that, I think, was for the inspector. So for drinking water wells, you do not have to have a PG on site, but you do need to have an agent of the state. So somebody who is certified as a registered environmental health specialist or REHS. Yes.
Great, thank you. All right, so the three of you, any last comments or notes or tips for the audience? All right, well.
There's a question that Ralph poses, which is, won't the radon gas outgas in the shower? So the answer is, it depends on if there's radon in the water first. Secondly is, at what level is it going to be releasing, if you will, in the shower? And the only way to know that is by testing your indoor air quality to make sure that you know what you're exposed to. And it's not just the shower. I mean, if you think about it, the dishwasher, the washing machine have a greater volume of water that you're releasing. So it's potential that those would actually be more of a contributor to your indoor air than the shower. It depends on how long you take a shower, of course.
Thank you, Philip. All right, well, we are coming to the conclusion of our seminar today. I want to thank you all for a great discussion. I hope that each of us listening walks away with some new insight today. I would like to take a moment to thank our guest speaker, Evan Kane. Thank you for presenting. And to our guest panelists, Philip, Rachel, and Tom, thank you for providing such great discussion. And thank you to our audience for attending today's seminar. Following the closure of the seminar today, each of you will receive a request to complete an evaluation survey where you'll be able to provide your thoughts and suggestions on our seminar today. You will also have the opportunity to enter any additional questions that you weren't able to ask during the seminar, and we will get those addressed for you. So please complete the evaluation, as we would appreciate your feedback, as it assists us in being able to meet your needs in the field. Thank you again. Have a wonderful day, and we will see you next time.